Bismillah Rahman Rahim. In the last lecture, we discussed about polyps and tumors of the intestine, in which we studied the various types of polyps of the intestine, like neoplastic polyps or non-neoplastic polyps. You know that non-neoplastic polyps, they are of further types like inflammatory polyps, hyperplastic polyps. And then neoplastic polyps, they are adenomas and carcinomas. Tubular adenoma, villous adenoma, tubulovillous adenoma, and adenocarcinoma. And in the adenocarcinoma, we studied about the pathogenesis of adenocarcinoma. You know that there are three pathways of pathogens: APC beta-catenin pathway, and then microsatellite instability pathway. So today we will discuss about acute appendicitis. And acute appendicitis is very common in adolescents. And inflammation of appendicitis, presents with pain in the periumbilical region, then pain in the right iliac fossa. And it may be confused with certain other conditions like mesenteric lymphadenitis and acute salpingitis in females, ectopic pregnancy in females. So that you must be very careful in diagnosing acute appendicitis. So causes of acute appendicitis, often 70% of cases, they are caused by obstruction in the lumen. There is increased intraluminal pressure, and then intestinal obstruction, that is appendicular obstruction. Sometimes it is caused by a stone of feces, that is fecolith, and parasites, especially Enterobius vermicularis. So clinical features, patients present with first pain in the periumbilical area, then that shifts to the right iliac fossa. Patient may have nausea, vomiting, or fever also. And types of acute appendicitis: acute erosive, acute suppurative, and gangrenous, depending on the pathology. So this is the grass specimen. In acutely inflamed appendix, the glistening serosa is changed into rough, lusterless color, and it is dilated sometimes. And what is the microscopic appearances? So first there is a vascular congestion in the subserosal area, and lumen contains inflammatory exudate consisting of granulation tissue and neutrophils. And these neutrophils, they penetrate into the wall. And histologic diagnosis of acute appendicitis depends on the demonstration of neutrophils through the muscularis. If there are no neutrophils involving the neutrophils, microscopically we don't label it as acute appendicitis. So neutrophils must infiltrate the muscularis propria, and sometimes it extends beyond the wall of the intestine, the appendix, that is into the periappendicular tissue, into the mesentery and periappendicular fat. So there may be localized peritonitis. Complications of acute appendicitis: rupture of the appendix if it is not treated earlier, that may lead to peritonitis. Gangrene formation due to ischemic necrosis of the appendix, and then septicemia. So that was about the acute appendicitis. So investigations we carry out diagnosis of acute appendicitis. So first the basic investigations like complete blood count. There will be leukocytosis, and there will be neutrophilia. ESR may be raised, and then ultrasound, and microscopically you see the microscopic features. So then is the tumors of the appendix. Although tumors are rare in the appendix, but they can occur in the appendix, and most common tumor which occur in appendix is carcinoid tumor. So carcinoid tumor is, is a well differentiated neuroendocrine tumor, and it occurs at the tip of the appendix. Then mucinous neoplasms may occur. Mucinous adenoma, low-grade mucinous neoplasms with low risk of recurrence. Then low-grade mucinous neoplasms with high risk of recurrence. And mucinous adenocarcinoma and rarely adenocarcinoma. So these are the tumors which can occur in the appendix. So what is pseudomyxoma peritonei? Pseudomyxoma peritonei is a clinical term, and it may be seen in ovarian mucinous tumors or mucinous cystadenocarcinoma of the appendix. There is mucin secretion by the tumor, and this mucin leaks into the peritoneal cavity, into the whole abdomen. And that is called pseudomyxoma peritonei. So that was about the appendicitis and appendical tumors.